The deadly mass shooting in Monterey Park is raising discussions about mental health care. Tonight, we're taking a closer look at stigmas and pressures embedded in Asian American Pacific Islander cultures. I talk one-on-one with a local leader in the AAPI community about the challenges Asian Americans and Asian immigrants may face and why they might not try to get the help they need.
The assumption is they don't need help, when in fact they do.
That can be tied back to what scholars call the model minority myth, a tool of white supremacy to pit Asian Americans against Hispanic, Latino, and Black Americans.
When society could say, look at Asian Americans and Pacific Islanders and they're succeeding, why can't you, as another minority group?
Ultimately putting Asian Americans on a false pedestal.
Because of this myth, puts a lot of psychological pressures on our communities to really uphold these false standards. And as a result, they don't seek out the necessary treatment that they need, again, mental health being one of them.
Tragically, certain members of the AAPI population have bought into that myth. The American Psychological Association says Asian American college students had a higher rate of suicidal thoughts than white college students. The concept of saving face or avoiding humiliation is also strong in many AAPI cultures.
And it puts a lot of pressure on them because of the model minority myth. We're again trying to meet these expectations that society has put upon them. There is stigma when you take advantage of these services that are offered.
Older adults and new immigrants can face additional challenges.
If you look at our older, elderly, more senior first generation immigrants who don't speak English or lack, again, English skills, they are oftentimes unable to access these services that, again, government offers.
Syrian says one way we as a society can address that is to make sure there is language access for our seniors and for our first-generation immigrants whose first language is not English, and to let them know that these services are available to them.